Hello and welcome to your ultimate guide for the ATI Adult Medical-Surgical exam. My goal today is simple: give you everything you need to fully understand the key concepts, master them, and walk into your ATI Adult Medical-Surgical exam with total confidence. In this video we'll cover wellness concepts, environmental variables, health continuum, clinical differences, health promotion. With over 100 plus success stories, we have proven our videos will help you pass your exam on the first attempt. And remember, our website offers free exam guides and practice questions to help you ace your ATI Adult Medical-Surgical exam. You'll find the link in the description below, so be sure to check it out and get the resources you need to study smarter, not harder. So let's get started.
Let us start with the foundation of everything: health and wellness. Health and wellness combine to form a state of optimal physical functioning, along with a feeling of emotional and social contentment. Wellness is the ability to adapt, both emotionally and physically, to a changing state of health and environment. Adapting is the heart of wellness. Here is what makes this so important. The level of health and wellness is unique to each individual and relative to that person's usual state of functioning. We never measure a client against an absolute standard. We measure them against their own baseline. And because the environment keeps shifting, a client's health is constantly changing too. Let me give you the classic example your textbook uses. Picture a person who has rheumatoid arthritis, a strong support system, and a positive outlook. That person might consider himself perfectly healthy because he functions at his optimal level with minimal pain. This shows us that health is absolutely possible within a chronic disease. Here is another angle that deepens this idea. Because a client's health is constantly adapting to a fluctuating internal and external environment, the same person can be more well on Monday than on Friday. Wellness is not a fixed label you earn once. It is a moving target that shifts with stress, support, and coping. So why does this matter for your exam? Test writers love to check whether you understand that health is relative. They might describe a client with a well-controlled chronic illness and ask if that person is healthy. The answer is yes. Avoid the trap of assuming any disease automatically means a person is unhealthy. Here is a simple way to make this stick. Think of the word wellness as a synonym for adapt. Whenever you see wellness on a question, ask yourself, is this client adapting to their changing health and environment? If yes, they are demonstrating wellness even if they still carry a diagnosis. In short, adaptation is wellness. And here is the part most students miss. Because health is individual, the nurse must always connect care back to each client's own perception of their health needs. Two clients with the same diagnosis can experience it in completely different ways. One feels devastated while another barely slows down. Meet each client where they are. What we just covered is exactly the type of material you will find in our free practice question bank. These are not just basic recall questions either. They are designed to test your deep understanding of how health is relative to each client, just like the real ATI and NCLEX exams will. Now, this is where it gets interesting, and it is one of the most heavily tested ideas in this entire chapter. The variables that affect a client's health fall into two categories. Modifiable variables can be changed. Non-modifiable variables cannot be changed. Knowing which is which guides every health promotion decision you make. Let us break down each category. Modifiable variables include smoking, nutrition, exercise, sexual practices, and access to health education. Each of these is a behavior or circumstance a person can actually change. Non-modifiable variables include sex, age, developmental level, and genetic traits. These are fixed. No amount of teaching will change someone's age or genes. So why does this distinction matter so much? Because nursing interventions target modifiable variables. When you teach smoking cessation, plan weight reduction, or improve access to health education, you work on factors the client can change. We do not build health promotion teaching around genetics or age because the client cannot change those things. Let me walk you through an exam-style example. Imagine a client who smokes on social occasions, has a body mass index of 28, and a history of reflux. Every one of those is modifiable, so each one is a target for your teaching. Now, compare a client with alopecia or trisomy 21, which are genetic. Here is a quick memory trick. Ask one question about every variable. Can the client change this with effort and support? If yes, it is modifiable and fair game for your interventions. If no, it is non-modifiable. Genetics, chromosomes, age, and biological sex always land in the non-modifiable column. That question saves you on test day. Let me ask you this. When you hear the word health, do you only think about the body? Most people do, but health is actually multidimensional. Your textbook identifies 7 distinct aspects of health and wellness, and a whole person experiences all of them together. Let us walk through each one so you can recognize them. The first aspect is physical, being able to perform activities of daily living. The second is emotional, adapting to stress and expressing and identifying emotions. The third is social, interacting successfully with other people. And the fourth is intellectual, effectively learning information and then sharing or disseminating that information to others around them. Let us finish the remaining 3 aspects. The fifth is spiritual, adopting a belief that provides meaning to life. The sixth is occupational, balancing work activities with leisure time so you do not burn out. And the 7th is environmental, creating measures that improve standards of living and quality of life. Together, these 7 paint the full picture. Picture how this plays out with a real client. A man recovering from a heart attack needs physical healing, but he also needs emotional support for his fear, social connection so he does not isolate, and spiritual care to find meaning. If you treat only his body, you address just one of 7 dimensions. How can we make 7 aspects stick? Try this phrase. Please excuse some imperfect spiritual occupational energy. The first letters point to physical, emotional, social, intellectual, spiritual, occupational, and environmental. Run through that phrase on test day and you will list all 7 dimensions without missing one. Mnemonics are lifesavers under exam pressure. On your exam, watch for questions asking which dimension a scenario describes. A client joining a support group after a loss is working on the social and emotional aspects. A client finding peace through prayer is addressing the spiritual aspect. Match the behavior in the question to the correct dimension for quick, reliable points. I know we are covering lots of detailed information and you might wonder how to practice applying it all. That is precisely why I put together those free practice questions. They help you work through scenarios that combine multiple concepts at once, just like the questions waiting for you on your nursing exams. Now let us talk about the environment because health constantly adapts to it. The nurse must assess 2 environments for every client, the external and the internal. The external environment is the world around the client. The internal environment is everything the client carries inside. Both shape health powerfully and deserve your attention during assessment. Let us look closely at the external environment first. It has a social side and a physical side. The social side includes crime versus safety, poverty versus prosperity, peace versus social unrest, and the presence or absence of support from social networks. The physical side includes access to healthcare, sanitation, clean water, and geographic location. Now turn inward to the internal environment. This includes the client's cumulative life experiences, cultural and spiritual beliefs, age, developmental stage, and gender. It also includes emotional factors and the client's own perception of how their body is functioning. Think of the internal environment as the personal lens through which each client experiences health. Here is how both environments come together in real life. Imagine two clients with the same infection. One lives in a safe neighborhood with clean water and easy access to a clinic. The other faces poverty, unsafe housing, and no nearby care. Their external environments differ enormously, so their paths to recovery differ too. Assess the whole environment. On your exam, watch for clues pointing to internal versus external. Words about beliefs, past experiences, age, or personal perception signal the internal environment. Words about water, safety, neighborhoods, and access to care signal the external environment. Sorting these correctly helps you choose the right assessment focus, and it sets up our next concept beautifully. Let me give you a memory hook for the two environments. Think of external as everything outside your skin, your neighborhood, your water, your access to a clinic. Think of internal as everything under your skin, your beliefs, your past, your emotions, your perception of your body. Outside is external, inside is internal, simple and reliable. Now, this is where it gets really important for your exam. The illness-wellness continuum is an assessment tool used to measure a client's level of wellness, ranging all the way to premature death at the far end. Nurses use it to set goals, improve a client's health, or help a client return to a previous state. Here is the single most tested feature, so really lock it in. At the center of the continuum sits the client's own normal state of health. The range runs from optimal wellness at one end to severe illness at the other. But the middle is not a universal average. The center is this particular client's personal baseline. Let me expand on why a personal center matters so much. The degree of wellness is always relative to the client's usual state of wellness, achieved through awareness, education, and personal growth. The healthcare professional helps the client see where they are on the continuum and find ways to move toward their optimal wellness. Let me give you the example the exam loves. Which client sits at the center? At their normal state of health, the client with well-controlled rheumatoid arthritis, because that managed condition is their personal normal. A client with influenza, new diabetes, or a urinary tract infection is measured against their own norm, having shifted toward illness. So how does this show up on test day? You will often see a question asking, which client is at the center of the continuum? The trap is picking the client with no diagnosis at all. Remember, the answer is the client at their own normal baseline, even with a well-managed chronic condition. Personal normal is key. Here's a way to picture the continuum in your mind. Imagine a long horizontal line with a dot in the center, and label that dot with your client's name, not the word average. Optimal wellness sits to the right, premature death to the far left. Anchoring the center to the individual keeps you from the average trap. If some of these detailed concepts feel challenging right now, do not worry at all. That is completely normal, and it is exactly why I created that comprehensive practice question bank. Working through those problems on the continuum and the variables will solidify your understanding and build confidence before you sit for the real exam. Now, let us tackle a distinction that trips up so many students: illness versus disease. Disease is a condition that results in a physiological alteration in the composition of the body. Illness is an altered level of functioning in response to a disease process. They are related, but here is the key: they are not synonymous. Let me make this concrete. Illness is the impairment of a client's physical, social, emotional, spiritual, developmental, or intellectual functioning. It encompasses the effects of a disease on a person. But because they are separate, a client can feel ill without measurable disease or have a documented disease while not feeling ill at all. Think about this for a moment with two examples. A person in the early stage of high blood pressure has a real disease, yet feels completely fine, with no illness experienced. Now flip it. A grieving person may feel deeply unwell and unable to function, yet have no measurable disease. Disease and illness do not always travel together. Why does this distinction matter at the bedside? Because your care must address the illness, the lived experience, not just the disease on the chart. A client whose lab values look fine may still be suffering greatly, and that suffering is real and deserves intervention. Treat the person and their functioning, not only the numbers. So what shapes how a client responds to illness? First, the degree of physical changes caused by the disease. Second, the perceptions held by the client and others, which can come from reliable or unreliable sources, like friends, magazines, television, and the internet. Something frightening read online may shape a response far beyond the clinical facts. There are more factors that shape the response to illness. A client's cultural values and beliefs play a major role. So does denial or fear of the illness, and so do practical realities like social demands, time constraints, economic resources, and access to healthcare. The response is rarely about the disease alone. Here is a classic exam application about denial. A statement reflecting a lack of understanding or denial sounds like a newly diagnosed client saying, "I need a second opinion. There is no lump." That is denial of the illness itself. Comments about family history, hospital access, or scheduling influence the response but are not denial. How can we keep illness and disease straight in memory? Disease is physical and objective, something you could measure in the body, so link disease with data. Illness is personal and experienced, how the client feels and functions, so link illness with the individual. Disease is what the lab sees. Illness is what the person lives. Remember that mastering these concepts takes practice and real application. The free practice questions I built help you take what you're learning here and turn it into exam-ready skills. They mirror the way nursing exams blend illness, disease, and client perception into a single tricky question. Go grab them today. Now let us bring everything together with the nurse's ultimate goal: health promotion and disease prevention. The desired outcome of all our care is to obtain and maintain an optimal state of wellness and function. We reach it by giving clients access to and helping them use health promotion, wellness, and illness prevention strategies. Let us get specific about the nurse's role in this mission. First, you use health education and awareness to reduce risk factors and promote good health care. Second, you evaluate the health needs of each client and create individualized strategies to meet them. Notice the pattern: assess the need first, then build the plan around it. How do clients actually achieve health and wellness? Through health education and positive action. The book highlights stress management, smoking cessation, weight loss, immunizations, and seeking healthcare when it is needed. Notice that every one of these is an action a client takes, which connects right back to those modifiable variables we discussed. Let us look at the interventions nurses use to promote health. You provide resources that strengthen coping abilities. You identify and encourage support systems during illness and stress. You identify obstacles to health and create strategies to reduce them. You reduce health risks to improve compliance, and you develop education methods that raise health awareness. This brings us to a major nursing role, recognizing why a client may not follow the plan of care. The book lists several obstacles to compliance. There is the client's perception of the illness, the awareness of how severe it really is. There is confidence in the provider, and there is belief in the prescribed therapy itself. there are still more obstacles to keep in mind. A client who had a negative experience with the healthcare system may not trust the provider or follow advice. Cultural or religious beliefs might not align with treatment. Support system availability matters. So does family role, where one member is the caregiver but neglects her own care. Let me show you how finances become a real obstacle. Financial restrictions can lead a client to prioritize healthcare, choosing what to pay for and what to skip. Think of a parent who seeks medical care for the children but not herself, or a client who cannot afford prescription costs. These are difficult financial trade-offs. Here is exactly how this becomes an exam question. Picture a client who struggles to follow a diabetic diet and remember medications. The compliance-boosting actions are asking the dietitian to help with meal planning, contacting the support system with consent, encouraging a daily medication dispenser, and providing educational materials for home use. Assessing cognitive awareness is not itself one. How can we remember all these obstacles to compliance? Think of the phrase, "Pretty cats bring calm, furry friends." It points to perception, confidence in the provider, belief in therapy, culture and religion, family role, and finances. When a client is not following the plan, run through that list to spot what stands in the way. As we begin to wrap up this overview, remember that understanding these concepts is only the first step. The real mastery comes from applying them, which is exactly where those free practice questions become invaluable. They are completely free. They live in the description below, and they were designed specifically for your nursing exam success. Before we close, let us connect the assessment pieces. A complete health and wellness assessment includes a physical assessment, an evaluation of the client's health perceptions, identification of risk to their health and wellness, and identification of their access to health care. Every concept we covered today feeds directly into that assessment. Nothing stands alone. Let us bring it all home. Today you learned that health and wellness are individual and relative, measured against each client's own baseline. You learned that illness is the experience of impaired functioning, while disease is the physical alteration in the body, and that the two are not the same. You separated modifiable from non-modifiable variables. We also explored the 7 dimensions of wellness, the internal and external environments that shape health, and the illness-wellness continuum with the client's own normal state at its center. And we finished with the nurse's central mission, promoting health, preventing disease, and removing the obstacles that keep clients from following their plan of care. Now take a deep breath and feel proud, because these foundational ideas are the lens you will use for every single client throughout your nursing career. They show up on the ATI exam, on the NCLEX, and at the bedside every day. Master them now, and everything that comes later in your program will feel much clearer. So here is your next step. Do not forget to grab those free practice questions from the link in the description. With the knowledge you have gained today, plus focused practice on these questions, you will be incredibly well prepared for your nursing exams. Go put it into action, believe in yourself, and I will see you next time.